I think a really important question that's going to arise in HER2 positive metastatic breast cancer in the coming years is if we move T-DXd into the first line. So if DESTINY-Breast09 is a positive trial and we replace the CLEOPATRA regimen, THP, which is the current standard, with T-DXd in the first line setting, I think we're going to be left needing, really needing data to help us understand how long does the T-DXd have to go on for? Because right now in the CLEOPATRA regimen, our current first line standard, we use about 6 months, maybe 4 to 6 months of chemotherapy, and then we drop the chemotherapy and we continue with just HER2 directed therapy, which is so much less toxic, so much better for quality of life. I think that's great for our patients who we know can get really durable benefit out of that approach and also really lead a pretty normal life without too many side effects. In DESTINY-Breast09, if that's a positive trial and we move T-DXd into the first line setting, the way that that trial approached it is just continuing T-DXd until progression. So not that first 4 to 6 months and then a maintenance phase, but indefinitely for as long as the patient is benefiting and has acceptable side effects. And that's, that's a really different paradigm because T-DXd is a very effective, but also it's a toxic drug. And so I anticipate patients will stay on first line therapy for a long time with that potentially toxic regimen. So I think the key question that's going to follow if those are positive data is, how can we study doing more of a induction and then maintenance approach with T-DXd in the first line setting? Can we do X number of cycles, 6 months of T-DXd, but then transition to the HP that's part of the CLEOPATRA regimen that we're also used to? I think we're going to need those efficacy data, those safety data, feasibility data, PRO data, because I would anticipate that that's going to be really important for patients. We don't want to keep them so long-term on a toxic therapy if we could actually, give them a break after an induction phase.